Good morning, everybody. I hope you're having a wonderful day. It's beautiful outside, and we're still in the midst of the coronavirus pandemic. What really bothers me, though, is there's this either/or thinking that's going on, and it's troubling because it really negates all the heterogeneity we see in reporting. My goal is always to look at the data. Now, the data are those that are prepared by the experts. So if either we agree with experts or we don't agree with experts. I don't want to believe anybody who's in the media because they're filtering the data. I want to look at the data, the raw data, what are provided by the epidemiologists. So here you can see I'm on the Pennsylvania website. Now I'm on this website because I live in Pennsylvania and I want to make sure that I have the best data possible for where I live. So if I click the coronavirus outbreak link, it'll take me to their special area for the coronavirus. Now I focus in on this one site right here. This is cases. And it gives me this really nice dashboard and this really great looking set of figures. And I'm going to look at hospitalization. So if you think about so I'm going to actually zoom in on this because there's a link here where you can view full screen versions. This is the full screen version. What we're mostly troubled about are two things: hospitals. Well, actually now three: hospitalizations, death, and then some long-term effects. Long-term effects are going to be primarily for individuals who have a pre-existing condition. Now, you may not know that you have a pre-existing condition until later, and that's the issue. So you may have some cardiac abnormalities, vascular abnormalities that you're not aware of, pulmonary, your lungs abnormalities that you'll find out later. And for those individuals, it's difficult. I mean, I'm an asthmatic. I don't know what the coronavirus could do to me, right? So those are real issues. Those aren't fake. So anybody who says that that's fake, you're out of your mind. Okay, that's number one. The other thing that, of course, like I said, I'm worried about is hospitalization. When one goes in the hospital, you never know what's going to happen because in the hospital you can get these pathogens that are spread just by the fact that you're in the hospital, right? So there's a lot of bacteria and other viruses around, and you don't know what the healthcare providers are doing. Hopefully they're washing their hands appropriately, especially now, but people can actually pass germs or other viruses around, right? Pathogens around. And of course, the worst case scenario is death. So let's take a look at the ones that we can take a look at right now are hospitalizations and deaths. So this is in Pennsylvania, just so that I want people to not be panicking. I want you to look at the data. So this is Pennsylvania, lots of different colors. You can click each of these areas. Like this is Bucks County, and this is how many cases there are. There's confirmed. So this is at all time, right? Total cases confirmed plus probable cases. I like that they're using probable cases. There's 972 basically per 100,000. So if you were to grab 100,000 people, 972 of those would have tested positive. Now, of course, that's assuming that, and this is important, it's assuming that the tests are accurate. And I'm not 100% sure in their accuracy unless we know what the sensitivity and specificity of the tests are. So in terms of hospitalization, right now in Pennsylvania, this is Pennsylvania data, right? There are 682 hospitalized cases. I hope you understand that. That means there's 682 hospitalized COVID-19 cases. Of those, 92 are on ventilators and 4 are on ECMO. So that means that we're using all in total, not just related to coronavirus, in total 1039 of the 5,360 available ventilators. If we look at percentages of ICU beds available, intensive care unit, right? 41.4%, surgical 39.7%, pediatric 37. Pediatric ICU, pediatric is 59.4%, airborne isolation 65.4%. So So this is telling you that there is room available, right? There is room available should an issue occur. And we don't want any issues to occur. So let's make that clear. We don't want any bad issues to occur. But right now, the situation in Pennsylvania in terms of hospitalization is not horrible. And I'm not making this up. I'm certainly not political. Any of you who knows me, I'm a Bernie Sanders supporter. So I'm not a Trump supporter. I'm not a Biden supporter. I'm a Sanders supporter. So be clear on that. So I'm not making up data. I have no need to make up stuff from anybody. I'm just giving you the facts here. In terms of the death report, let's look at the deaths from, this is July 10th. So this is a weekly report published by the State Department of Health. It's amazing. There's 8,880 souls lost to the coronavirus so far. If you want, you can click this link here. You can actually get to the death certificate to see how they're calculated in case you don't trust the way people are calculating deaths. Pretty well split evenly between males and females. As I've said before, there's a disproportionate number of African Americans dying, although the raw numbers suggest that whites are dying at a greater rate than non-whites. Well, there's more white individuals in Pennsylvania. There's 12% of the population is African American, and they count for 21% of all coronavirus deaths. This is what I wanted you to look at here. So just so that we get an accurate impression of where the deaths are occurring. It is said that coronavirus is primarily a disease that affects the elderly. Well, it makes sense because if you think of your cardiovascular system, it's going to have more injury when you're older. Our parts tend to not last forever. They tend to wear out. It's not like we can just change our timing belt every 100,000 miles. We don't have such abilities. Well, you can see the distribution of deaths is primarily at the oldest age, or there's this highest values between 85 and 89. So I calculated here the proportion of deaths for individuals based on these numbers. Now, these little asterisks here are less than 5, so they're just suppressed anywhere. So the percentage of deaths below 60, so this is from birth to 59, is 7%. I included this one because this is my age range here. So I went a little higher. 7%. I'm repeating that again. That means 93% of all deaths occur in individuals 60 and above. Okay? Just want to make sure you're clear on that. So this is a disease that is affecting the elderly the most. So I'm going to pass over this, although you can look at, if you're interested, you can see that if we take the individuals who died in long-term care and hospice, so those are individuals who are already under care for either just being very old or on the verge of dying, and we added those up together. Here we have 3009, 3009. The reason I'm not adding hospitalized because anybody could be in the hospital, right? So we already saw that divided by, I think it was 6880. Is that what I said it was? 6880 by 6880 by 6880. It's 46%. So 46% of all deaths occurred in either a hospice situation or at a long-term care facility. And as before, I've also looked at comorbid conditions. These are other conditions one already has. It says approximately 37% of death records did not include comorbidities. That means most individuals, right? 63% had a comorbid condition. The most popular of the comorbidities were hypertension. Well, see, this makes sense because hypertension, your arteries are your vascular system's already compromised to a degree, so this is already putting you at greater risk for the cardiac-related injuries associated with COVID, dementia. It's probably because of age, diabetes, but these are all very important. So that's what I wanted to talk about today. Really, my goal today was to just make sure that you understand that this is a condition that requires us to understand the data. We have to look at the data. We cannot ignore it. I know people who, every time there's another case happens, they panic. Well, you can't do that. I mean, there's a lot of good evidence out there now, a lot of good research being done. Like one of the recent best reviews I read out of JAMA said that the viral load is the most important facet of the transmission of the coronavirus. So you need a lot of particles to bombard you, right? Regardless of how, through aerosols or what have you, in order to become infected. And that usually happens when we're in close contact to one another. So the suggestion there was that 15 minutes of close contact seems to be the heuristic for the required time for transmission of the coronavirus. So think about it. If you're just out in public somewhere outdoors and you just pass by somebody, you're probably not going to get sick. I mean, it's very unlikely. That 15-minute type rule doesn't apply when people are sick and they're coughing and sneezing, etc., of course, because there's a lot more particles discharged in those instances. So that's very interesting. So you need exposure to be infected, prolonged exposure. I'll just follow the Japanese 3 C's, right? Avoid close contact with individuals, avoid closed spaces, and avoid crowds. That makes a lot of sense. And wear your mask. That's what I have to say for today. I'm checking out. Bye.